Hi, welcome to Berrien County Hospital, and I have Dr. Lee here, and I appreciate you taking the time out of your day to come and talk with us about our new emergency department providers at Berrien County Hospital. We've recently contracted with Southland of Nashville, and can you tell me a little bit about our community outlook with our new emergency room?
Sure, Stephanie. We're excited to be here. Nashville and Berrien County is just we've found it just to be a great place, and the hospital emergency room has so much potential, and we really want it to be a place where if you're in Berrien County, we want you to come to this hospital and use this emergency room. And so we have really spent a good bit of time and are continuing to spend time on really evaluating how to make this, how to provide the services in a way that the community really that comes here and is very pleased with the type of service they get. And that's from a number of aspects, from the quality of care they get, obviously is at the top of the list, from their wait times, from the interaction with the staff and our providers, as well as having the connections within the surrounding community and surrounding hospitals for when additional services are needed, that we can arrange that very easily. But our goal is to really make this emergency room capable of managing and handling the needs of Berrien County.
I wanted to talk to you about some of the changes that we have at Berrien County Hospital going on. We added a new triage nurse. Can you tell me how that process works?
Well, one of the in our evaluation of the ER, how to really make things work better here, we've learned that we have quite a high volume of patients through a part of the day, and we had to really evaluate how to see patients quicker and get people back. So one of the things we incorporated was a new triage process. We've incorporated as well as using a couple of rooms that we were not using initially. This has allowed us to get people back. The new triage process we typically are now doing is, when possible, we try to get people as quickly from when they're registered straight back to a room, so that we can have a triage process where the nurse triages the patient. Often the provider can get in there much quicker. If the provider can't get in there quick enough, we have some initial protocol orders that we can start on some of the most basic things to get the process going, to speed up the patient getting back and getting their necessary evaluation started. And I think it's going to work very well. I mean, it's a way to really use our resources and to speed up the process of getting people seen and getting things handled.
I know a lot of times people sometimes are concerned about coming to a small rural hospital as far as what type of emergencies a small rural hospital like Berrien County can handle. Can you kind of talk with us about what the emergency room here in Nashville can handle?
Sure. I mean, surprisingly, we're emergency medicine trained doctors and have worked from the smallest hospitals to the largest, and clearly have an understanding of what we handle at certain places. Really the truth is, most things we can handle right here. We have very, very capable staff, very, very capable providers, very, very capable doctors on staff that really handle most everything. We clearly handle all of the basic illnesses and general injuries quite easily. From orthopedic injuries, there are times, as you well know, that there can be an orthopedic injury bad enough that there needs to be a higher level of specialty care. But very often, even for various fractures, there are, we can manage it, we can diagnose it, we can splint it appropriately and get the patient appropriate orthopedic follow-up right from Berrien County. We can handle from chest pains to abdominal pains to seizures to mental health. Most everything we can handle here, our goal in smaller hospitals is to have pathways set up. So if we get something here, and we say, we really need something here to happen. This person, this situation needs a little bit more specialized care. We can handle it here. We can get things started appropriately, and we've set up very independent tracks to some of the very close facilities that have the specialty care, that we can make the proper calls, get the right doctors involved, and get the patient more directly sometimes into the other facility and to the additional specialty type care that they need. And so we've had to really focus on when that is needed, which is not very often at all. That can occur very quickly.
Okay. And I know that currently Berrien County Hospital is undergoing some renovations in their ER. Can you kind of touch base on, since you've been here a couple of months, where we were and where we're going?
Absolutely. Well, we have been just thrilled with the response from the staff, the current providers, and administration on the kind of things we're doing here. It's really been amazing. We are now, we've looked at some of this, we've added a nurse into the emergency room that works an entire extra shift that did not occur. We've renovated the emergency room. We're getting new equipment, and it's being done right now, a complete renovation of the ER, which is just going to be a tremendous benefit. We're using additional 2 rooms that we have very closely associated with the ER to have a larger area that we can work out of. And the hospital has supported these changes completely, and with this currently just being done or in the middle of these renovations now, but are really just going to be a tremendous asset for this hospital in Berrien County. I mean, the emergency room is going to be essentially a completely renovated facility with new equipment and some updated staff. I think it's just going to make a tremendous difference in the overall quality of care and the experience that one has when they come to Berrien.
And we also have here at our location at Berrien County Hospital, we have an attached nursing center, Berrien Nursing and Rehabilitation Center, and we also have our Dogwood Senior Health Center,
Right.
a geriatric psych unit. Can you talk about the continuum of care with an emergency department and being so close to those patients and residents in those facilities?
Sure. Well, both these facilities are extremely important to the community and to the hospital, and they function well. They I've met several. They're just tremendous staff that works with them. In these facilities, both of these facilities, you often do need some acute care. We often have obviously an older group of patients there with various medical conditions, and there's a tremendous benefit here for these facilities to have this hospital and the emergency room so closely associated with it. We really made a real effort to, these patients are generally managed without problem, with any issues come up on or by their doctors within their facility. But what we have now done is made it very easily, and we're very accepting of any situation that needs to be evaluated for additional concerns, and the patients are easily moved to the emergency room. Their record goes with them, and we can evaluate for any potential new acute illness, from a developing pneumonia or other type of infection to something more serious, that we can quickly evaluate the ER, then determine if they need admission to the hospital for more closely watched care and treatment. And it's so easy to do, and it's really a great benefit for the patients in these facilities to have such an immediate response and a higher level of care.